The Hair, Heart, and Health Program of Washington, D.C. was designed to help African American men and women with undetected risk for heart disease access screening and education in a non-traditional healthcare setting. The program was first sponsored by Care First Blue Cross Blue Shield in the Baltimore area and was expanded to Washington, D.C. in the spring of 2007. In Washington, D.C., where the African American community suffers from some of the most serious and difficult to control high blood pressure rates in the country, the Hair, Heart, and Health Program has been designed and managed by the MedStar Research Institute and funded through Care First Blue Cross Blue Shield.
I had headaches first, then I went to the doctor and they said I had high blood pressure.
I was taught that it was a silent killer.
We tease each other about what's going on and what we see physically, but we don't know what's happening internally.
High blood pressure is an enormous problem in the Washington, D.C. area. And it's an enormous problem for a number of reasons. Here we are in the nation's capital, one of the most prosperous cities in one of the most prosperous countries in the world, and we have one of the highest rates of high blood pressure, heart attacks, strokes, and kidney disease.
Barbers and hairstylists are being used in the Hair, Heart, and Health Program because they are natural leaders in the community. It has been a long tradition of them passing on information to their clients, so it's natural for them to be a part of Hair, Heart, and Health. Elevation starts 140 over 90, so you're not near those ranges, all right?
So I'm all right?
Right.
There are young men out there that don't know that they have high blood pressure, and they actually have extremely high blood pressure that over the years are going to cause problems. So this was a way to try to tap those people.
Care First was excited about the opportunity to reach into our community and to partner with social leaders. In this case, barbers and hairstylists.
A lot of young sisters, I would say 30 and under, who barely get to the doctor, they've been questioning us. We explain to them how they can be better and how they can live longer lives.
I was one of the first participants of checking the high blood pressure here at Fresh Cut 2. And by me checking my pressure at that time, I found out that my pressure was up.
I took his blood pressure. This young man's blood pressure right here. His blood pressure was extremely high, and he works in the shop with me, you know.
Because I work here and also get my hair cut here, I can get my blood pressure taken more as opposed to going to a clinic or my own house, which I don't have a monitor at home. So.
You know, like in our neighborhood, to actually find out your physical condition without you having to go out. No, but I didn't know that it was a high degree of us that might have had high blood pressure, anything that we actually had to deal with that would bring them into our businesses.
By me being in the program, they were comfortable with me because we talk all the time. So they were happy that I had the program here. They felt comfortable with me and and they thought I was their special, their little private nurses. So they loved it.
Glad that somebody is they're interested where they could come in and try to help us, and glad that people in the neighborhood are participating in this to check their health.
I thank them for doing this for me, because if it wasn't for them, like I say, I wouldn't even known that I had my pressure was up at that time.
It's made a big difference, and we all appreciate it. We appreciate being able to render the service, and they appreciate being able to receive it.
And I want to thank Hair, Heart, and Health for coming by and giving our shop a chance to be represented in Black men's health.
The long-term plans for Hair, Heart, and Health is we want to become a culturally relevant part of the healthcare delivery system that is run out of neighborhoods.